Hemorrhagic fevers. So this is actually a group of diseases caused by different viruses, and usually, depending on what type I'm talking about, they're geographically limited because of the reservoir's distribution. So with that in mind, the reservoir varies depending on the agent. Most are going to be vertebrate animals though. The transmission can be, again, we're talking about different types. So vector-borne, in that case, we're talking about yellow fever, dengue fever, and chikungunya. Direct contact with body fluids is going to be Ebola, Marburg, and Lassa fever. Signs and symptoms. All of them are going to share the same major symptoms. 1, extreme fevers, and 2, internal hemorrhaging. You're going to see bleeding with these. With Ebola and Marburg, they're going to progress with that hemorrhage all the way to death. Specific symptoms for the specific varieties. Yellow fever is named for the specific symptom of the patient having jaundice. Their skin turns yellow, their eyes, the white of their eyes will turn yellow, and it's because of the fact that there are bile pigments in their body that shouldn't be there. The specific symptom for dengue fever is extreme pain. The specific symptom for chikungunya is going to be arthritic symptoms, so your joints. Ebola and Marburg, massive hemorrhage, massive hemorrhaging. Lassa fever, you've got chest pain, you've got deafness. I said this at the beginning, the hemorrhagic fevers are caused by different viruses, so each is caused by a separate virus by the same name, and we'll talk about that in the next few slides. Pathogenesis. The agents enter the bloodstream through vectors or direct contact, depending on which one you're talking about. While the virus is in the bloodstream, you have capillaries becoming very, very fragile. And on top of that, the sequence of events to cause blood clotting is also disrupted. This combo actually leads to very uncontrolled bleeding and eventual hemorrhage. As far as treatment and prevention, well, it's supportive care for all of these, except one. It's supportive care. I can make you comfortable and hope you survive. The only one that is different is Lassa fever. I can treat that with antiviral ribavirin. But everything else, we hope you survive. Prevention, all preventions would be limited exposure to the transmission route. With yellow fever, there is an actual effective, very good vaccine available. And because of that, the disease has been eliminated in the United States. Not all over the world, but in the United States. Dengue fever, there is a vaccine in development, but the others, avoiding the reservoir or the transmission route is pretty much the only prevention you have. Yellow fever is found in Central Africa. You can see here that this man's eyes are yellow. Instead of being white of the eyes, they're yellow, and that's because of the bilirubin that is in their bloodstream that shouldn't be there. With dengue fever, you kind of have two, levels of symptoms. If you have the mild symptoms, you've got headaches, pain behind the eyes, nausea, vomiting, high fever, rash, flu-like symptoms, and joint and muscle pain. When they get severe, or if they get severe, you're talking about shock, severe pain in the stomach, not just nausea and vomiting. Now you've got severe pain, a drop in blood pressure, severe bleeding. That's the reason we call them hemorrhagic fevers. Severe vomiting, difficulties that will affect your heart, your lungs, and your liver. And you'll see bruising under the skin. Remember what I said about it being hemorrhagic and it damaging the blood vessels. Chikungunya is transmitted through the bite of the Aegypti and Aedes albopictus mosquitoes. So these two specific species of mosquitoes are the ones that are transmitting it. The second is only found in Ebola. Symptoms wise, you can have fever, headaches, tiredness, depression, nausea, rash, and it is similar to dengue with the body aches, but they tend to be more intense in the joints and the tendons. The other thing is this can become chronic where it lasts forever instead of it resolves itself, and it can actually cause blindness as well. Prevention: don't store water in open containers so that they can't become breeding sites for mosquitoes. We know that here in South Texas. Cover tanks or containers for water for domestic use. Don't accumulate trash. Dispose of it from your yard. You don't want to have little nooks and crannies where water can kind of stay and breed mosquitoes. Cut your grass regularly to destroy potential breeding sites or resting sites for these mosquitoes. Use mesh or screens on your windows and doors. Use repellent or long sleeves to avoid getting bitten. I said this before, it's viral and it's caused by infected mosquitoes. In about the first 48 hours, you're going to have kind of high levels of discomfort. It's going to cause fever and severe joint pain. Other symptoms are rashes and swelling, specifically in the joints. The accuracy of testing for this particular disease depends on timing. There is not a specific cure. Luckily, unlike dengue that is mostly fatal, this is not. Unfortunately, patients will still be experiencing symptoms 6 months later. To prevent this disease, just like we said there, keep yourself covered, scrub your hands before eating, keep your surroundings clean, avoid outside food, use mosquito repellent. I guess one of the benefits with this is that if you do get it, you only get it once. Once you've had it and gotten over it, you don't get it again. So this is what the rash looks like that you may get after getting chikungunya. And like I said, it tends to affect the joints. So you're constantly in pain from your joints. Ebola and Marburg. This is Ebola. This is what the virus looks like. This is Marburg. Both of these diseases are hemorrhagic diseases. And when Ebola first kind of came onto the scene and they realized it was there, they did mistake it for Marburg. This disease is awful and it causes such severe hemorrhage that people will bleed to death from the amount of blood vessel damage and the hemorrhage that happens. They'll bleed from their eyes, their ears, their nose, their mouth, just in general, their skin. People that treat people with Ebola and Marburg are covered from head to toe because it is that transmissible from person to person. Now remember, these are people who are bruising under their skin, sometimes it even blisters. They're hemorrhaging underneath that skin. And the blood vessel damage is so severe that if they were to develop a cough, they could cough up blood and splatter it on the people that are taking care of them. You can see here that this woman is actually bleeding from not only her mouth, but her ear. As far as symptoms for both of these diseases, the incubation is usually 6 to 21 days, and it starts out very gradually, usually with general weakness and malaise. You're tired, you don't feel good. After a few days, you get a headache, you get a sore throat, then you start to develop muscle pain and chest pain. You'll start with I'm nauseous and you start vomiting, diarrhea, cough, and abdominal pain. Even in this picture, you can see this kid is bleeding from his mouth and his nose. There is nothing that they can do for Ebola except try to make you comfortable. And it is anthrax. Historically, this disease is important in the field of microbiology. Specifically, Koch's postulates were actually developed using anthrax. In the early stages of vaccination testing with Louis Pasteur, he used anthrax. It is a zoonotic disease of herbivores. So when we think of livestock, we think of herbivores, cows, things like that. And typically we associate it with cows. The reservoir, it can be soil or it can be livestock. Because the livestock carry it and they are on the soil, they can transfer it to the soil. It does have multiple forms depending on the route of entry. That will determine the presentation of the anthrax infection. And you'll see why in just a second. Transmission route. It can be through soil or air. It can also be inhaled. It can be indirect contact with infected animal hides or through food, and you can ingest it. All forms of the bacteria gaining access to the bloodstream can lead to septicemia though. Septicemia is a possibility here. Cutaneous forms, usually from indirect contact, so the infected animal hides, you're going to see skin symptoms. If you inhale it, you're going to see respiratory symptoms. If you ingest it, then you're going to see GI tract symptoms. So the pathogen that causes this is Bacillus Anthracis. It's a gram-positive bacteria. It is an endospore former, and its primary habitat is going to be the soil. It produces an exotoxin that can initiate shock though. Bacterium enters the body through one of these routes that I mentioned, and it gains access to the bloodstream. Death that occurs with anthrax is usually caused by septicemia. Treatment, antibiotics. Prevention. There is a vaccine for high-risk individuals. The issue with the vaccine, though, is how long it takes to get through the course of the vaccine. It takes about 1.5 years to get all of your inoculations for the anthrax vaccine for it to be effective. If I can't get you to take antibiotics for 7 to 14 days, what do you think the chances of me getting you to take an injection for 1.5 years are going to be? I'm not saying you have to take it every day for 1.5 years, but it's a series of injections that takes place over that 1.5 years. For it to be effective, you've got to do that. If you don't, it's not going to be effective. You're not going to get the numbers that you need. So those 6 inoculations, you have to have them. It's effective, it's a good thing, but getting people to do it, especially over 1.5 years. So this is anthrax, this is what it looks like. They can be inhaled, the spores enter the lungs, they travel to the alveolar spaces. Spores can be transported through the lymph system to the mediastinal lymph nodes, that's right around the heart, and they can make toxins in that area that can be deadly. So let me explain the virulence of anthrax in 2 different forms. Most of the time, if you ingest anthrax, it's not deadly. You get diarrhea and stomach upset for a few days, but you get over it. There was a case, probably in the 90s now, that a man wanted to win an election, and he knew that after church, everybody went to Pizza Hut. So he took anthrax and sprinkled it on the salad bar at the Pizza Hut. Yeah. A lot of the people didn't show up Monday to vote because they were homesick. Now, the funny thing is, well, I guess not necessarily funny. The thing was, with so many people presenting with it, it had a common origin. Remember we talked about that, the pinpoint origin? With that in mind, they quickly figured out that everybody that got sick went to this salad bar. They also quickly figured out what was making them sick. They caught the guy, he got arrested, and that was the end of that. Needless to say, he didn't win the election. However, inhaled anthrax, because of this right here, can be very deadly. In, I want to say the late 90s, early 2000s, there was a series of letters that got mailed that had anthrax in it. And the anthrax was created to be so small that it aerosolized when you opened the package or opened the envelope, and it was inhaled. This killed There was a microbiologist. I want to say he worked for the CDC, but I'm not positive. He developed a form of anthrax that was so minuscule that it aerosolized very easily. And he mailed it to specific people, hoping that when he opened it, it would aerosolize and they would breathe it in and this would happen. The thing that was scary was that the spores were so tiny, so teeny tiny, they actually went through the paper. So you didn't even have to open the envelope and the spores would be there. One of the people that he mailed a letter to was Tom Brokaw, who, if you may not remember, but he was a news anchor for, I think, ABC at the time. His assistant is the one that checked the mail. He didn't. So his assistant ended up getting anthrax and dying. Inhalable anthrax, especially because of this path right here, is a lot deadlier than ingesting it.